Okay, let's have another example. And it's coincidentally, it's some work I've done with the same researcher. This was a cost-benefit analysis of 20 mile per hour speed limits. I'm afraid I'm the generation in Britain who grew up with miles, and kilometres are always a bit difficult for us because of my generation. I think this is about 32 kilometres, 35 kilometres per hour. I don't know. It's that sort of, I don't want to be too specific. I guess you use kilometres in Japan, do you? Yeah. Okay, let's call it 35 kilometres. In city areas, that was the idea. And so, again, it's a real policy that they wanted to have evaluated. And the idea was through changing the environment, you can do what's called traffic calming. You can slow down traffic. Now, one thing you can do is change the speed limit. Now, I suspect that works in Japan. If you say the speed limit is now 30 instead of 40, I imagine people here slow down. Britain is not really like that. You can change the speed limit, and some people will slow down, but many won't. But there's a lot of other things you can do as well through the design of the road layout. And you can narrow roads and things like that. You can put in what we call sleeping policemen. A sleeping policeman is a bump in the road, a speed bump. And that helps encourage people to go more slowly. So there's various things you can do. So what we looked at in this research was there were parts of London where they had introduced traffic calming measures. They had introduced attempts to reduce the speed limit. And they did this at different points over time. So what we did was what's called an interrupted time series. You looked at, over time, areas which the traffic hadn't been calmed, and then some set of policies or investments were made to try and calm the traffic, and then you looked at the effect over time. It's called interrupted time series. And what we're trying to do here was then also control for all the other factors which might give rise to differences in casualty rates. So what we're monitoring over time is the number of collisions, the number of pedestrians injured, the number of motorists injured. But of course, it's not just the speed limit or other related traffic calming that influences casualty rates. In the UK, probably in several countries, not just the UK, over time, there's been a secular decline in driving under the influence of alcohol. If we go back in time, it was much more common for people with alcohol in the bloodstream to still drive. It's become less common over time. Now, that's going to be a problem for your evaluation, because if there's changes happening to casualty rates anyway, when you introduce traffic calming, you might mistake some change for a change that would have happened anyway. So you've got to, in trying to establish how well this intervention's working, you've got to be able to try and control for all the other factors, such as the underlying rate of change in road traffic accidents. You then also face a problem about any change you observe, attributing it to your new speed limit. Now, if it occurs directly after you introduce your speed limit, you feel more confident that change in casualties, accidents, can be attributed to the change in speed limit. But how long is it likely that that will be the case? So what about 3 months after the speed limit has changed? Will it still be having an effect? Or is any change that observed 3 or 6 months later, is any change likely to be for some other reason? And so in our study, we assumed the changes, if there are going to be any changes, would take place all within the first year. And after that, there wouldn't be additional changes as a consequence of your change in the speed limit. Now, we have this problem of attribution as well when we look at new drugs. For example, what we quite often find is patients can take a new drug and it appears to change their health state, and then they stop taking it, possibly because of adverse effects or possibly because they progressed. But even after they stop, the patients who had taken the drug and stopped quite often appear to do better than those who never took the drug. So the challenge there is, how much of the benefit after you stop taking a drug can you attribute to the drug? And it's not uncommon for if we're thinking quality terms, the quality gains from the patients after they stop taking the drug seem to be greater than the quality gains while they were taking the drug. Now, your intuition is this can't quite be right. You try and think, what mechanism is giving rise to it? Well, it's something similar here. How long after a change, after some intervention, how long can you continue to attribute any changes to that intervention? So you've got that challenge. Looked at, graphically, something like this. So you intervene at the sort of 0 just now, and what you're having to do, we're looking here at casualties per kilometre per year. That's our sort of target we're trying to affect. We're trying to reduce the number of casualties per kilometre per year. So there's various challenges we've got. One is, if nothing had happened, if we hadn't introduced traffic calming, what would have happened to casualty rates? Now, they could have been at this level here and just continued, unchanging. On the other hand, as I say, there are quite often factors out there leading to some underlying or background rate of change. One factor I mentioned already is that fewer individuals are intoxicated with alcohol while in charge of a motor vehicle. And so there's some sort of background rate. There's also other changes that have been taking place. Motor vehicles are getting safer. Various safety devices over time. Increasing proportion of vehicles have airbags. Brake systems are more effective than they used to be. Maybe tires are better than they used to be, etc. So in this study, we had to first of all make some, what we call it a guess, an estimate about what the background rate of change was likely to be. Now, of course, there is some evidence to base that on. We can look at long-term changes in casualty rates over time and try and work out what the rates seem to be changing at. Of course, that just tells us what the current rate of change is. It just tells us this rate here. But we have to go further than that. We have to say, will it continue? How long will it continue? 5 years? 10 years? And again, it's rather difficult to know. So, the areas where they're focusing traffic calming were areas with relatively high casualty rates, higher than the average. And we then are making an estimate about what would have happened if we hadn't intervened. And so if we hadn't intervened by traffic calming, we're assuming that casualty rates per kilometre per year would have gone on falling anyway, falling at the same rate as this background rate. Now, by analysing casualty rates over time with this interrupted time series, we can then compare casualty rates before the intervention with casualty rates after the intervention. And that will give us an estimate of the change in casualty rates. And this drop here. Now, that's very helpful, but the question is the difference going to be constant over time or not? Or is, in effect, the benefit of the intervention, is it going to taper? For example, do motorists respond initially quite a lot to the new speed limit, the change in the design of the roads, etc., more enforcement activity? But do they then over time begin to drift back to how they used to drive anyway? Another problem, if you introduce traffic calming, will motorists still drive the same route they drove before, the same frequency they drove before, or will they in fact change their journey to avoid the traffic calming? So do you then end up with more casualties on the uncalmed roads? So it's worked on the roads that you focused on, but you've just shifted the problem to the other parts. Well, there's no right answers to any of this. These are the difficulties of trying to evaluate what at first sight seems quite simple. Let's reduce speed limits. It doesn't really matter, but it appeared in our analysis to be fairly cost effective. But it's sensitive to how long you assume the benefit goes on. Because what's happening, of course, I should emphasize this, you're sort of incurring a lot of the costs now. You're changing the layout of roads, you're using publicity to tell people about the changed speed limit, you're employing police over time to do more monitoring of speed limits, etc. You incur the costs now, but the benefits are in the future. And so depending on how long you assume the benefits, the reduced casualties go on for, that has a big effect on your estimate of cost effectiveness. Now, these problems are in a way the same problems we have when we're evaluating a new drug. But new drugs, we can do a trial. We can control for a lot of factors.